But just to beat up the bursitis thing, a little bit more.
Yeah.
Say I'm your patient still. But Dr. Singh, I can't take anti-inflammatories. I get an upset stomach. Even Advil upsets my stomach terribly. And I don't want to be one of the 16,000 Americans that die every year from simple over-the-counter or prescription anti-inflammatories.
Yes.
So we look at those as very safe class of medicines when in fact they're not. And so I know that they're dangerous and I really don't want it.
Okay.
So tell me how you're going to treat my bursitis because I can't play tennis.
Okay, so for example, if you're not able to take what we call a non-steroidal anti-inflammatory medication, which damages your stomach lining for sure. In fact, we as orthopedic surgeons, we like to joke with our GI colleagues, so we keep you in business.
Right.
We give so many anti-inflammatories because people have inflammation. But anyway, we can bypass the gut. We can bypass, we can go straight to the gist of the problem. In your case, you're a hand and wrist expert, and what you do with that is basically what I do with the shoulder. We can inject an anti-inflammatory steroid medication straight into the bursa, absolutely nicely suppressing the inflammation and healing it in that sense. But that's not the end of the treatment. We still want to add physical therapy. Again, not taking an anti-inflammatory medication. We can apply heat, we can apply cold, we can apply appropriate times of stretching.
Activity restriction.
Absolutely. Some we restrict, some we say push a little bit harder, but regardless, we get the patient through if they can avoid, and you're right, there are a lot of patients who have had gastric bypass surgeries or surgeries that do not let them take anti-inflammatory medication. We can work with that.
Yeah.